cells and differentiate. Does that make sense? Embryonic stem cells are the first. So stem cells have different potencies. How many tissues can they? The embryonic stem cells can create all your tissue. And the earliest of those can also make your placenta and your cords. Adult stem cells only make specific tissue. They differentiate to make specific tissue. So we were interested in cord blood originally because of this particular population of cells, CD34 positive cells. Now these are hematopoietic stem and progenitor cells. These are the cells responsible for making blood. So your immune system, your red blood cells, your platelets, right? But cord blood is actually made up of a lot of other stem cells and progenitor cells. You can find mesenchymal stem cells. These are the cells that produce your cartilage, your fat, your bone. There's also neural progenitors in your cord. There's also endothelial progenitors in your cords. So the endothelial progenitors are the cells that make your blood vessels, okay? So cord blood is actually very rich with these stem and progenitor cells for multiple tissues. But we'll focus mostly at the beginning on this hematopoietic stem cell. But I don't want to ignore the fact that also this is blood. So there's immune cells in there. And those immune cells are actually quite useful for us in the clinic too, because those immune cells are unique that they can actually turn off some of that pro-inflammatory cytokines that are produced during certain diseases. So can the mesenchymal stem cells, and we can utilize that to turn off like cytokine storm associated with many diseases, and I'll talk about that in a little bit. All right. So why is cord blood important in the clinic? One is because cord blood collection has those stem cells, and those stem cells and cells are easy to collect. So cord blood collection does not harm the mother or the child, does not interfere with the birthing. We could take the baby, have the cord blood, which would normally do is clamp the cord blood and cut it, but once you can take that clamped cord blood and collect the blood from it and draw this into a special collection bag. We could transport this into to our laboratory and examine whether or not that cord blood could be useful to save for later use. And I'm going to tell you right now, even if we can't save it to use for clinical use, we can save it to use for research. So not one cord blood would be wasted, right? Then we could save that for long-term storage in our bank and have them available for patients. It's one of those primary was for hematopoietic cell transplantation in non-malignant blood disorders. So when we talk about how many students about, you guys know what leukemia is? So that's one of the blood cancer malignant disorders. But we can also use it for non-malignant disorders, such as some severe anemias and immunodeficiencies and metabolic disorders. And this is a life-saving treatment. This is not just a prevention of future, like delay of future relapse. This can be a cure for many of these illnesses. So we have to think about the fact that these transplants can cure people and from developing further disease for the rest of their lives. So how do we do this? We take our patient and we give them immunosuppressive regimens of either a combination usually of radiation and chemotherapy. This kills off the disease cells and allows to make room for new non-disease cells to be given to those patients and for them now to redevelop a new blood system. So there is many sources that we can get stem cells from. There's bone marrow, what we call mobilized peripheral blood, where we make the stem cells leave the bone marrow and go into the blood. So we collect it from the stem cells from the blood, and then umbilical cord blood, which we'll talk about today. And there's two ways we can transplant. One is autologous. So we take the patient's own stem cells and we give them back to the patient. Or we can give allogeneic transplant, which is when we have a donor. and then we give those donor cells. I'm going to go into this more detail, but so will others throughout. So this is one of the best water cooler discussions ever, right? And this is was actually from 3 individuals: Hal Broxmeyer, Edward Boyes, and Judith Bard. He was an and he's like, well, you know, I need more samples to be able to study immunology from, and it's not always easy to sample in blood. And there's a use of the blood that's left over in the cord after birth. And Hal's like, no, I wonder, I bet you there's stem cells. And like, it just was a random conversation. Thinking outside the box, what can we do with these, right? And so a lot of research is through random conversations that we have each other, that we get random ideas from, and we test them out. We take the time and effort to test them out. And it turns out they were right. So I miss this kind of conversation since COVID, because we do a little more online stuff. And it's these random conversations sometimes we have in the hallways that makes the best break. So I was like, I bet you there is hematopoietic stem and progenitor cells that could be used for transplantation within those cords, right? But you can't just try it. You have to answer some questions first. And so I actually have a picture of his office at Sloan Kettering, where they wrote out the questions they had to answer to be able to show that cord bloods could be used for transplantation. First question that he wrote down was, how many hematopoietic progenitor cells or stem cells were contained in the cord blood? Were cord blood hematopoietic progenitor cells comparable to the bone marrow ones? At the time, we were getting most of our donor cells from bone marrow, right? So you're not going to be able to replace or have another source if it wouldn't be equal to that. They're going to just keep using bone marrow, right? How long after collection are the cells viable? So, like, if we collect the blood, I mean, do we have to use it right away, or can we use it weeks or years later? How should the cord bloods be shipped, right? Can we ship it at room temperature? You don't understand how many questions you actually have to answer before any of these procedures could be used in the clinic. So, can it be shipped? Does it have to be at ambient temperature? Put them on ice? Believe it or not, putting stuff on ice is not a good thing, because it can actually change some of the membrane components of the cell, make them not as functional. That's a word. Your blood will eventually also have to be frozen at some point. Would the freeze-thaw process kill any of the stem cells to make it usable? So these are questions that he had to answer before they can actually bring this into the clinic. So they did this through years of work, and they evaluated over 100 cord blood samples. I'll abbreviate cord blood with CV just because space. So what they did with each of those 100 cord blood samples is they looked at the total volume, the nucleated cell count. So how many nucleated cells are in the blood? Those are your immune cells, and where your stem cells would be. On the cells without nucleus in your blood are your red blood cells and platelet. And so what they want to know is what the nucleated cell counts were, which would be how many potential stem cells might there be in there. The ability of those stem cells to be functional, so they do this through colony formation. It's an in vitro, meaning outside the body test that we can use to look at a stem cell and progenitor cell function. And how much of that function is preserved after we freeze and thaw those tissues. So these are the original lab notebook results. And this is actually the results from the cord blood of the very first cord blood recipient, Matt Farrow. And you can see the cord blood volume that they were able to collect is about 130 milliliters. From the placenta, they got another 30 to 35 milliliters of cord blood. the cell count, the viability of those cells. Then they went on and they did freeze functional assays, post-freeze functional assays. And then they collaborate. By this time, Hal was in Indiana University, and Ed Boys was still in Kettering, and he was taking these cells and transplanting them into mice. And these were immunocompromised mice, because otherwise the mouse would be like, oh, wait, that's human. That's not normal. I'm going to get rid of it. So what they used is the severe immunocompromised mice, and they transplanted these human cells, cord blood cells, and they found that they got engraftment. So this was published in Procedures of National Academy of Science in 1989. But this work was actually done in around 1985, and they waited to publish. There's a reason why they waited, and I'm going to tell you that in a second. But while this work was being done, they developed their clinical team. That clinical team is composed of Arlene Erbach. She was a specialist in Fanconi anemia. That's the disease they decided to start with, right? Because Fanconi anemia was well established in the transplant world to be cured by the transplant. So they thought it was a good place to start. And she helped first do some tests in the animal model to show that the cord blood could be used to treat Fanconi anemia. Then they got a clinician. And this was not going to be done in the United States without a lot more work up front. So they ended up going to do these first transplants in Paris, Elaine Gluckman. And Elaine was her specialty was transplanting patients with Fanconi anemia. So she was brave enough, this takes bravery on the clinician side to test a new therapy, right? She was brave enough to be the volunteer to do those first transplants. And then they needed to find a patient that could be utilized for these first transplants, and a family that was brave enough to try it. And that's where we get Joanne Kurtzberg. So the first patient they actually wanted to transplant fell through. Unfortunately, the child that they were going to get the cord blood from, the sibling of the patient, actually had the mutations for Fanconi anemia, so they couldn't utilize it. So they moved on to another patient that they thought could benefit from the cord blood transplant. And that patient was Matt Farrow. Matt Farrow was important. His sister that was born was actually HLA matched. How many of you guys know what HLA is in the back? No, students. So you know when we talk about like you have to match the I'm sure you heard this in that you have to find a donor match, right? Okay, so I know you guys watch those medical television shows. You know about like you have to find a match for the kidney or a match for the bone marrow, right? So there is molecules called HLA that is what your immune system sees and recognizes cells as foreign from. And you need to match those close enough that the immune system or your body doesn't reject those cells. And so we wanted to make sure that if the cord blood didn't work for the transplant, we could get bone marrow from that baby to do a transplant from the stem cells in the bone marrow. So we have a backup, right? And it turns out that Matt's sister was a match, a good enough match for transplant if they had to go into the bone marrow. So they took his cord blood, and Hal ran all the tests in his laboratory at Indiana to see if these cord blood would be a viable source. And they were. So that transplant was performed in Paris in 1988. Matt Farrow, seen here, was the first transplant recipient. His family took a chance on this new scientific finding. And this is his sister who saved his life, her cord blood. And on a Pan Am flight from New York to Paris, was from Indiana to New York, then New York to Paris, the fall of 1988, Hal's lab manager, Scott Cooper, lugged a 25-kilogram container of liquid nitrogen with frozen human cord blood in it, flew first class to Paris. He was so excited. It was his first time, one in Paris and two flying first class. He was sitting next to a liquid nitrogen, but he was excited about the prospect. And then the Broxmeyer group met with Elaine in Paris, where the first transplant happened on October 6th. So this is the original itinerary from the Broxmeyer lab, getting prepared for the shipping of the cord and then the first transplant. So this is where Scott Cooper left. He left in September. They gave themselves plenty of time to get that cord there, make sure it was going to arrive there without getting thawed in the process, making sure everything was still viable and usable prior to the transplant. Hal later followed. You can see here he left in early October, on October 3rd. And then you can see this was the first transplant right here. And his pencil handwriting, which he continued to use throughout his life, he notes the first transplant. He stuck around for 3 days and then left to go back to Indiana to do more research, because anybody Hal Broxmeyer, he could not sit still for more than 10 minutes of his life. This is Hal. This was the equipment that we originally used. This was the first apparatus to use to freeze the cells. And these were the liquid nitrogen containers they used to transplant. The big boy, what we called the original transplantation tank, was what sat in first class with Scott Cooper. This had the first 3 transplants worth of cord blood, back and forth transplant. And the little boy was what was used for the first leukemia transplant, which I'll talk about in a second. So funny, because Big Boy actually stayed in the hotel room with Hal so you can keep an eye on that cord blood. And he was so scared about I don't know if you guys know what happens. Liquid nitrogen, when nitrogen is used in science to displace oxygen to make things hypoxic. You can study hypoxic environments. He was so scared that he's just losing all the oxygen in his air. In the middle of October in Paris, where it was cold, he left all his windows open, so he stayed nice and cold through that whole process. But we still have these. These are now sitting in my laboratory. I want to preserve the history, so I've been keeping them. So they're actually sitting next to my postdoc's desk right now in our lab. So this is Matt Farrow, post-transplant with Elaine. And this was the very first paper in the New England Journal of Medicine. This is a big deal to get a paper in the New England Journal of Medicine. It's one of the top clinical journals that you can get a publication in. But if you know the date of this, same year, the original findings of that stem cells were in a cord. And I'm going to tell you why this is the case. Because nobody believed them. They had all this data, and nobody believed them, even with all this data. And so he's like, I'm not putting out this publication until I have clinical data that shows that this works. This happens a lot when you're developing new technology. This is why in research, you have to have a thick skin, right? You have to, because a lot of research is rejection, right? Till you get enough people that have been able to reproduce what you have seen, right? You're going to get, well, I don't believe that, right? I don't believe that at all. And then you get 3 or 4 other labs that got the same thing, and then people believe you, right? So the lesson to learn is, with research, you get the excitement of being the first person to see something. But you have to have a thick skin, because you got to wait the time out for others to repeat what you've done so they can see how important it is what you actually found. And this was important because Matt was cured. And he's alive today and doing very well. But another thing I want to teach the history of cord blood, because we have to have an understanding of what the patient went through and how brave they were through this process, right? He was, I think 4 at the time of transplant. He went to a foreign country where nobody spoke English while in isolation from his parents. He still suffers a little PTSD from that time period. So when we acknowledge and pat ourselves on the back for our great accomplishments in discovering and doing these first transplants, I want to emphasize the importance of the patient role, because that was brave, right? So every researcher and every clinician, talk to these pioneers. These patients are pioneers, and understand what they go through. One, that lights a fire under you. It'll motivate you to work 10 times harder, right? Talking to Matt has motivated a lot of what research I do in my lab. How can we shorten the time they're in isolation? How can we make it cheaper for the families? That kind of stuff motivates you to keep going. So, because of these life-saving breakthroughs that were developed, a lot of press started getting interested in what was happening. So there's this article that came out after the third successful cord blood transplant, Discovery Magazine, that talked about how great these cord blood samples were working as donor cells. And this was read by a grandmother of a child that had leukemia, and that child's mother, they had no success in finding a match transplant. So she brought this magazine article herself to her doctor at Johns Hopkins, John Wagner. And this led to the first cord blood transplantation for leukemia. This was published in Blood, which is a highly respected journal for the hematology field, where they showed that cord blood was a very successful donor source for those with leukemia. At the time, Dr. Wagner was doing his fellowship in hematology and oncology at So now we moved from an anemia to leukemia, so a non-malignant disease, and found that cord blood was highly successful. And the success of cord blood is continuously being in the news. This is only from a year or two ago. The New York Times published a piece where a woman was cured of HIV using via cord blood transplantation. So we're always finding new uses and new diseases that can be treated with cord blood. And since the discovery of cord blood as a potential donor source for transplantation, we have now seen over 40,000 patients that have subsequently received cord blood as a donor source and has successfully cured them of their hematological disorder or malignancy. One of Hal's proudest achievements was not the discovery necessarily of the cord blood, but 3 years before he passed away was a book that was made by the patients, over 200 patients that had survived and have been cured by the cord blood transplant. He kept that book with him at all times. And every new person that joined his lab for his research program, with him turning in the pages, because he wouldn't actually let you touch it yourself, he would let you see and read all those letters and where those patients were at and where they were at with their lives now, whether they had families and what their careers were doing. And that was his proudest achievement more than anything. And I also want to make a point, actually, that I didn't make yet. Hal's not an MD. Hal's a PhD. And it's important to emphasize where a benchtop scientist can contribute to the clinical field. That takes a lot of bravery also, and a lot of enthusiasm to take what you're doing at the bench and bring it to the bedside. And then to find a great collaborative group that's willing to do that. And Hal was a personality. Anybody of you guys knew him. He's very outspoken, very hardcore New Yorker. But he was able to foster that enthusiasm and that collaborative network. And Hal is a constant teacher and storyteller, which is why I know the history as well as I do, because you go to his office, you'll be there for 4 hours while he told you the history of cord blood. So where are we now? over 80 diseases and disorders that are currently treated using cord blood treatment. Blood disorders, cancers, immunodeficiency, bone marrow failure syndrome, metabolic disorders, and others. And this is just when we're utilizing cord blood donor source for transplantation. This is changing. Now, many more diseases have the potential in the future to be cured with cord blood, and I will talk about that a little bit more in my call to action later. But I'm going to focus today on what we're currently doing to prove transplant and a little bit of future treatment of other diseases. But through the process, now, first transplant, 89, right? So what did we learn between 89 and now? There's advantages and disadvantages, right? Because we've done it now enough that we know what the advantages and disadvantages are of using cord blood. Advantages, there's readily available cord blood, and there's no side effects or versus host disease. Remember I told you about finding like the proper matched tissue? But in transplantation, not like a solid tissue transplant, where you're putting a solid tissue in and that person's immune system will recognize that solid tissue as foreign. We're giving them a new immune system. So when you're giving them a new immune system, well, that body you're putting that immune system in is all foreign. So graft versus host disease is when that new immune system recognizes your whole body as foreign and starts attacking you. That's called graft versus host disease. Cord blood is prone to cause that. Now, it's thought because of that unique interface between mother and child. That may be part of the reason why that is. It's also generally thought to, as I said, to require less of an HLA match than other donor sources. And there's better access to hematopoietic transplantation for those underrepresented in the bone marrow registry. And that's because of that less perfect match that's required. But there are disadvantages. There is lower numbers of stem cells because we can only collect the blood that's within the cord. We can't go back and get more if we need it. You need more bone marrow, you go in and you collect more bone marrow. You need more mobilized peripheral blood, you go give them collect more mobilized. You're limited to what you have. So this makes cord blood more often used in pediatric patients than adult. You can get around this by using a double cord blood transplant for adults. That loses some of the benefit to the lower the GVHD. You also have a slightly slower recovery time with that, and it's partly that. It's also due partly to the low number of hematopoietic cells. It's also harder to go back in and get more cells in the meat. But with all this knowledge of the disadvantages, now we can go back to the bench side and figure out how can we fix this, right? So there's many strategies now being used to improve cord blood, and some of them actually have been now FDA approved to use in the clinic. And one of that is a new method, or one of those methods we can use the better. Oh, I can't go back, but one of those methods, the better cord blood transplantation, is improved collection methods and processing of cord blood samples to preserve HSC numbers and function. My lab actually just got a patent on new ways to do this. Another way is expand stem cells in culture before we go to transplant. Now, this is where we're seeing a lot of movement forward in FDA-approved strategies for doing this. This is also going to be important not just in the field of transplantation, but for gene therapy. Because understanding better ways to culture the stem cells and keep their function active is going to help us when we have to manipulate it for gene therapy. So this study and these studies done in cord blood is going to affect not just the cord blood field, but the bone marrow transplant field as the stem cell transplant field as well. Right? Enhancing the homing of those stem cells to the bone marrow. So when we transplant those cells in, you have to get back into the bone marrow to produce your blood, which is where your blood is mostly produced.
although there's some really cool studies showing other tissues, but I won't go into that because I can go on and on. But we have to get those cells into the bone marrow. And if they don't get to the bone marrow, they're not going to produce more blood. So one of our techniques we're trying to improve for blood is that maybe we don't need more numbers, we just got to get more of them into the bone marrow. And then once they get into the bone marrow, they have to be able to differentiate and create blood. And while what we're trying to do is, and I said there's that lag in recovery time with cord blood, to getting more of the immune cells to be produced, we're going to try to shorten that, right? So there's many techniques that are out there being tried right now. This is the stuff just my lab has put out with I was part of. Some of these we did clinical trials with and have been successful. We have New England Journal of Medicine using DPP-4 inhibition. We have a paper. We also have used we have a cell paper where we isolated out the cord blood under hypoxic condition to preserve the stem cell function. I'm not going to go through the science because I get too technical on that stuff, but we just say we've tried many a thing, and it's been we've been having some success. This is my current lab. I've taken. I'm in Hal Broxmeyer's lab space, which it's surreal because my postdoc is now sitting where I was sitting as a trainee, and this is my current lab. I have a graduate student who came from me from Maine. The lab manager from Ohio, Jim, who's a native Indianian, and myself. And then I have a medical fellow who is actually working on cord blood adjacent project. She's looking at the effects of maternal obesity on hematopoietic stem cell health in offspring. Although I'm very proud moment, both my senior trainees are moving on to their own faculty positions this year. They both left me at the same time, which is hard. But I can't be prouder. Merve is going on to Oklahoma to spread stem cell research to Oklahoma. And then Jim is just moving across the street. So I'm lucky he's not moving too far away. He's got an offer. He has process negotiating his startup package for the department building right up. So I don't have to change it to his desk. But my lab focuses on ways to cure cord blood, visualization of cord blood, and training my people to become future scientists. They're also researching cord blood. Jim's main focus is cord blood, and has actually given he won one of the best abstracts award at last year's Cord Blood Connect meeting. He's examining ways to better expand and maintain hematopoietic stem cell numbers by utilizing the conditions where those stem cells naturally live. So we're studying stem cells under their preferred physiological parameters and just utilizing that instead of drugs to increase stem cell function. So we're keeping them at a warmer temperature that where our body would be at. We're keeping them at a lower O2, which is the environment your bone marrow is in. And we're doing that without having to add any drugs. And it's pretty much free to do. It doesn't cost you anything really to increase the temperature or to lower the O2, except for the nitrogen, and that's $2.50 a tank. Okay, so we're trying to get that out and running. That paper should be going out this year. We're seeing a almost threefold increase in the timing of immune cell recovery and platelet recovery. And although we're not getting as many expansion in the stem cell number, their expansion in their function is high, which is more important than the number itself. Because often with these expansion assays, we can increase stem cell number, but not their function. We're also exploring new predictors of engraftment efficacy for the hematopoietic stem cells. So how well can the stem cells engraft? So can we improve that? Can we utilize what we know is a good engrafting cell versus a bad engrafting cell and find therapies that we can target to make those stem cells better engrafters? And also, as I said, we just got our first patent to look at new ways to develop new procedures to preserve hematopoietic stem cell function. One of that is a free therapy as well. It's just by utilizing our standard collection methods, but doing it all on ice. Increase 2-fold the rate of engraftment. So we try to find ways to make it cheaper. That's one of my lab's main goals. So where are we going? Now this is exciting, not necessarily my area of expertise, but I'm always so thrilled to hear these talks, and we'll be hearing some of those today. But where are we going with stem cells is moving out of what just the hematopoietic stem cell can do. And we're moving into more regenerative medicine. So what is regenerative medicine? Have you guys heard of in the back regenerative medicine? Okay, good. I'll define it for you then. So regenerative medicine seeks to replace the cells, tissue, and organs that have been damaged due to disease, trauma, or congenital issues. So stem cells, as I said, are there to replenish your tissue throughout your lifespan, help with the repair of that tissue throughout your lifespan. So we can maybe utilize that to do that by clinical application. So when injured or invaded by disease, our bodies have the innate response to heal and defend. So regenerative medicine's goal is to utilize what we know about these processes to help the body to heal better and to heal permanently damaged tissues and maybe prevent injury or untreatable injury or disease. And I'm just going to go back to what I showed you before. The stem cell or the cord blood is enriched with a lot of life-saving cells. We talked about so far today on my talk only this population, right? But all the populations of cells in the cord blood have life-saving capability. Some of that is the ability to modulate the immune response, but a lot of them are tissue repair mechanisms, right? In order to get tissue repair, we also need to be able to get more blood vessels. So some of these cells can be utilized for that as well. So all these cells have been tested preclinically, which means in animal models and on our bench, and have been shown to have promise. But now a lot of these are have published clinical studies and have moved on to the next step. And actually with COVID, we're finding a good role of MSCs in helping prevent some of the side effects of COVID. So what are some of these regenerative medicine clinical trials? Well, there's some that are out for brain injury, for such as brain injury at births and cerebral palsy and traumatic brain injury. Cord blood stem cells have been used from the child's own umbilical cord and have been shown to have promise. And we're actually going to hear from a survivor today. Juvenile diabetes studies have shown that autologous transplants of cord bloods can improve insulin production. Heart disease, cord blood stem cells have been shown to improve outcomes in patients following heart attack. Coronal regeneration, cord blood stem cells have the potential as a therapeutic option for treatment with disorders of the ocular surface, the eye surface. But there's many other conditions and diseases where cord blood have shown potential as a future therapeutic outcome. And one thing I don't mention here, but I'll talk about in my call of action, another very exciting field that cord blood has shown great promise in is immunotherapy. So, okay, good. Students in the back. How many of you guys have heard of immunotherapy? So immunotherapy is engineered immune cells to fight disease, right? And so cord blood is actually a great source of off-the-shelf cells that we can utilize genetically altered to make these cells. They have now been used in clinical trials for that purpose and have shown great promise. So that's all. I wanted to show you guys the importance of the future. So we've seen that cord blood transplants have been able to save over 40,000 lives, right? But with the future research of cord blood, we have the potential affecting millions of more. And so this is the importance of research and the collaboration between researchers and clinicians and the bravery of the patients who are willing to undergo those. So I encourage all of you students in the back, if you go into this field, you take the opportunity to shadow the clinicians and the scientists. You can see and talk to the patients because nothing will motivate you more than talking to the patients. All right. So with that, I'm happy to take any questions.
Any questions at all? That was fascinating. Oh my gosh, my mind is blown. Do you guys feel the same way? Incredible. And I think I speak for everybody in this room. We are so proud of you and keep up the good work. Oh my gosh. Any questions at all? All right, don't be shy. If you're thinking it, there's probably like 10 other people who are too. All right. Chandray is going to be checking in with our folks online. Any questions online? Oh, question.
I'd be happy to share my slides.
Slides are coming. Awesome.
Yeah, I'd be happy to.
Yes. Oh, the slides will be posted on Huba as well. All right, I got Blake in the back who's going to be my mic running guy. So Blake, thank you. He's going to get extra credit, I'm told. Right? Just pop it up.
Yeah, it is very fascinating, and thank you very much for that very knowledgeable information. Anyway, my question is about this children cancer network. How? Yeah, children CCN. Children. It's about the association of the Children Cancer Network. Have you heard of that?
No.
Anyways, I was just thinking, oh my gosh, this is a very good informations that the children who have hematopoietic cancer can avail of this great, this stem cells, cord blood. So I was wondering, how can we reach them, or how can they reach you? Something like that.
Yeah, so about 30 minutes, 40 minutes from now, we're going to have a panel discussion of some educational material that this group of lovely ladies down here have put together. And I've been lucky at the end to be added as part of, that's going to include some history of this field and more about what is cord blood, hoping to educate people earlier so that when they do become parents or look for a future career, they can know exactly what it is prior to that decision making. So yes, we are working on the educational material and you'll be hearing about it from all of us in about 40 minutes. Yeah.
Volunteers. Gladly, I'll be volunteer to be a conduit of that, your organizations and the Children Cancer Network. Oh, yeah, I am with the Philippine Nurse Association. I am one of the executive advisor now, past presidents, and I met Cherise during one of our conference, and from then on, I tried to increase awareness about cord blood transplantations through inviting her to our conferences and through supporting our Philippine Nurses Associations. And actually, from listening to you, more about children's awareness, because I really believe in that youth educations. And I was thinking, oh my gosh, I'm going to bring Arizona Cord Blood, invited all the youth, Filipino American youth, to be aware, to get education for this cord blood. Thank you.
We definitely need to talk because I think that's a good idea.
Hi, Dr. Capitano. I am a fellow Indianian. Woo! My parents went to Purdue, though.
Oh, okay. Well, forgive you for that, faux pas.
Are you on the Bloomington campus or the Indy?
Indy campus.
Okay. I was wondering where you source your research cord blood, because we have a really robust collection system. I'm at St. Joe's. I'm the biobank manager. And so we're not doing anything with the non-qualified specimens.
So I have a material transfer agreement with the Cleveland Cord Blood Public Bank. But that's only until I get my first grant, and then I'll have to start paying for it because it's sort of a favor until I get my lab up and going because I'm a new faculty member. And so let's talk because
we have a really diverse population in these cities.
Depending on what we're doing, often if we need to figure out best ways for cord blood collection or proving cord blood collection, we go ourselves and collect. So I am that person that's standing around outside the operating room of a C-section being like, hey, I want my blood. The FedEx guy has called all my lab members little vampires because we wait around for our shipments of cords to come in from Cleveland. And we're like, is our blood in? Is our blood in? And he goes, yes, my little vampires, here is your blood. Because you can tell the boxes easily which have the cords in it. So yeah, the theme, even on my Twitter account, is that we're all little vampires. So
anyone else want this microphone?
Great questions, great connections. Oh my gosh. Question over here. Go ahead and introduce yourself too, please.
Hi, I'm Linda Fabian. I live in Scottsdale. I'm with a company called Fremont Scientific. But I wondered how long the stem cells are viable after they're frozen. Do you have like a period of time that you can keep them?
Yes. We've now gone off to 30 years and they're still viable. That paper was published last year in Cell Translational Medicine. My postdoc, it was Hal's last paper from his lab. We finished it off for him. In my laboratory, we had 4 samples between 28 and a half to 30 years old, and they were still highly engrafted.
And they're frozen in liquid
liquid
nitrogen.
Yeah, we got those. We had some that were older than that, but unfortunately a grad student that was supposed to fill the liquid nitrogen containers didn't, and we lost them. So we actually had a collaboration with the New York cord blood banks that provided us with their oldest samples. And what was really great is last year's Cord Blood Connect, there was a group in Germany that had 27-year-old cords, and they were able to show very similar results. So we had 2 groups that were able to show that the cord blood was still viable after 30 years. And that's important because research has found that the exposure to stem cells to COVID actually has effect on their potency. And as we have increased chance of seeing more and more pandemics, we have a source of cells that have never touched these or seen these pandemics before, and have a source of very viable cells.
And the volume is?
Well, we did the transplant. We had purified the 34 cells prior to freezing. So we had over 1 million CD34s, which is about varies from patient to patient. So each sample had a different concentration of the stem cells. And that did have an effect on their viability, of course, but it was more the number of the stem cells and not their age that was associated with their ability to.
Thank you.
All right. So if any of the students have questions and they're too shy to ask, I'm around during the break. So if you want to ask me then, so you don't feel like you're in front of the whole room, go for it.
Okay, so here's the question. I understand that you can donate your cord blood, but what if the parent wants to keep it? What is a roundabout number of cost yearly that parents would have to pay to freeze their own, to keep their own?
I'm not comfortable because I don't know enough about the private cord blood banks to do that, as I do most of the research. But I'm sure you can ask some of our Save the Cord Foundation people, and they can help you with that answer. I'm sorry, I don't know, and I don't want to mislead you.
Okay, no worries. Thank you.
Great questions, great networking connections that are going to happen. Any other questions before we go to our friends that are online? Yes, in the back. Blake, you got them? Thank you.
Hi, I found your presentation very intriguing. So I was wondering, so for context, I've had psoriasis and autoimmune disease for about 10 years now. And listening to your presentation, I was wondering if you knew any information about like cord blood and its future implications on diseases like psoriasis and other autoimmune diseases, because all my doctors I've talked to throughout the years, they said that there's been small advances towards finding like a cure, but not 100%. I was wondering if cord blood does have implication in the future for that.
So some of the regenerative medicine studies have been utilized for some severe autoimmune disorders like type 1 diabetes. I wouldn't say we would do a transplant for those some of those autoimmune diseases because it would be a really harsh treatment for something that could be treated with other stuff. But there is an interest in especially some of the anti-inflammatory associated components of some of those cells in cord blood. And so that research is ongoing. It's a good question. Very good question.
Is there another question back there? Perfect.
Has cord blood been tested with treating rapidly replicating cancer?
So cord blood has been used to treat many of the aggressive leukemias, AMLs. So yeah, there has been some solid tumors that have been used for transplant, that they have received transplants, but it's more because some of the conditioning regimens, and they don't really do it so much anymore. I would suggest that later on, we have some great talks of clinician scientists who are going to talk about transplants. And those would be good questions because I'm more the bench person. So, but yeah, they could talk about that more in detail. And I'm sorry, I couldn't answer as well, but maybe like you can.
Necessarily take, oh, awesome, thank you. You don't take umbilical cord blood cells and then put them with cancer in vitro, but what umbilical cord blood has been shown to do is typically when a patient is getting a transplant, you want them to be in the best possible shape that they are. And what I mean by that is that their leukemia or their lymphoma, we shouldn't be able to detect it. Now, there are certain times when it's really hard to actually get that cancer into remission. And what umbilical cord blood has been shown is that if there is a little bit of leukemia there, that there have been successful outcomes showing that cord blood has what we call a graft versus leukemia effect. But would you want to give a cord blood transplant to someone that has full-blown AML? No, because that would never work. You need to get that leukemia and lymphoma at a low enough level, if that makes sense. Awesome. Thanks for jumping in there. Another question? All right, we'll go to this gentleman first, and then we'll get you next in the back.
Thank you very much. Very fascinating talk. So, knowing that recently, the topic of xenotransplantation in the solid organ area is becoming like a very promising approach in the context of cord blood. How much do you think that approach or in that context it could be possible or feasible to some extent?
I think it's an interesting idea, but it needs a lot more research. But I think we'll get there eventually. Yeah. There's some really good papers coming out on it, but we're not there yet.
Perfect.
Yeah, unfortunately, all this stuff takes time. I mean, what I presented seemed like that was a quick process. That was not a quick process. So, yeah.
Thank you. And the second question, I was interested. I work in the HLA field, and so I was based on your experience, particularly. I was curious to know to which degree has been evaluated or is it known which level of HLA matching or mismatching can occur, and depending on that, what are the possible clinical outcomes or how much you can play with that, for the benefit of the patient?
Yeah. Thank
you. So that's a really great question. So there are certain studies where let me back up. So in the types of transplants that we do for cord blood, it could be for a non-malignant disease or a malignant disease. And in the non-malignant cases, you really don't necessarily want to mismatch because that patient isn't going to benefit from a graft versus leukemia effect. However, in certain types of leukemias where they're at higher risk, you might want to actually mismatch a cord blood. And I will say that's what my preference was for a certain type of infant leukemia where they were at higher risk. I did prefer to do a mismatch cord in that situation because I wanted a better graft versus leukemia effect. But I would say there's still more research that needs to be done with that because you also take the risk of getting more graft versus host disease and then some of the other side effects. So
And right now with cord blood, some of the other aspects of transplant that people are going to be looking at is how do we prevent graft versus host disease? Mm-hmm. Because typically it's with calcineurin inhibitors and MMF, for example. And when we use peripheral blood stem cells and bone marrow, now the standard of care is post-transplant cyclophosphamide, and that has not been tested with cord blood yet.
Okay.
So it changes, is what I would say.
Perfect. Thank you very much.
Do you mind introducing yourself real quick?
Myself?
Yeah.
Yes, my name is Gonzalo Montero Martin, and I am HLA Director in Training at the Vitaland HLA Lab in Phoenix. We work with different programs, transplant programs, both in bone marrow and solid organ.
Awesome. Thank you. Welcome.
Thank you.
Yeah. There's a question in the back, I think. Adam Blake, thank you.
Thank you very much. That was a really good presentation. My name is Joseph. I'm with Gilbert Glasgow Academy. In the beginning, you mentioned something about how cord blood is being used to treat diabetic patients. A lot of members of my family have diabetes of both types. So I'm just wondering if you can give me a little more background on how cord blood can help with diabetic patients.
So I told you a lot of the cells that are found within the cord blood have the ability for tissue repair and possibility for that. Part of that is we can utilize it as a tissue repair mechanism, those cells. But also we have the ability to convert different cell types to what's called an induced pluripotent stem cell. And we can create new tissue stem cells from other tissues and utilize that to replenish that tissue's stem cell tissue. So like we can make a cell that is a hematopoietic cell in origin and make it into a cell that can create the islet cells of the pancreas that make insulin. And that's one way we get around using embryonic stem cells too. But this actually won a Nobel Prize for the scientists who developed this research, because now we can take cells and make them other cell types. And so it's very interesting. We could do that by just inserting 4 transcription factors, 4 genes, proteins. So that is where medicine is moving, right? So, and it's not just for treatments, but it's for creating the cell types out of human tissue for pharmaceutical companies to test their drugs on. So we could take a tissue from, say, somebody with Alzheimer's, create neural stem cells from those, adult neural tissues, all from a fibroblast from that patient, and then use it to do whole panels of pharmaceutical drug panels to test to see if you can increase the function of that cell that has Alzheimer's. So it allows you to take cells from tissues such as the pancreas, which is not always easy to get. You're not going to go and remove a person's pancreas to do experiments on, or their brain and do experiments on, but we can create cells from that own patient's tissue, recreate them into a new type of tissue, and then do research on that. So actually that I teach that in my graduate school course. We do different tissues, stem cells, and how we can manipulate them or manipulate other cells to become those cells for our future research goals. It's actually really cool if you want to learn more about it. Won the Nobel Prize a few years ago, so out of a Japanese group.
Awesome, thank you.
Any more questions before we check in with folks online? Yes.
Hi, thank you for your presentation. I wondered if there's any implications for the patients who receive this cord blood transplant afterwards.
You wanted to. Yeah. So that's kind of a loaded question, I'll say. So, but what I will say is that, you know, a typical patient that's undergoing transplant, the side effects are your immune system isn't going to be normal for at least a year. So the immune system is back to what a baby has. And all patients that undergo a transplant actually need to get all the immunizations that they had as babies, because you're educating this new immune system. Now, there's an advantage to that if you have leukemia or lymphoma, because that educated immune system then can fight the cancer. And then other side effects can be, as Dr. Capitano talked about, graft versus host disease. So there's two forms of that. One is acute, where it comes on within the first, 100 days, I would say, to 6 months. And then chronic, which typically happens after a year. And they're very different entities, I would say. And then other side effects for all transplant patients, when they're undergoing this process, they have nausea and vomiting. They can get mouth sores because of the preparative regimen and just the low white count. And the mouth sores literally line the entire digestive system. They need red cells and platelet transfusions because when you get rid of stem cells, you're getting rid of their the cells that actually make their platelets and red cells. And then fevers. So fevers are very common. And it's truly like within the first 1 to 2 weeks after transplant is a very critical time for patients, because this is when your immune system is at its weakest. You have no white cells that can fight. And so that's when most of these complicate, like not the graft versus host disease, but fevers and all those other things are happening. And then as time goes on, it gets better. But there's a lot of other things that can go wrong with transplant, such as organ dysfunction and things like that. It just depends on the type of patient, how much therapy they've had, and what their underlying disorder is.
So much. Great question. Did that answer it okay? Yeah, awesome. All right, any other questions from anyone here in the room? All right, Chandre's got some questions online. So there's none? Folks online, any questions? Don't be shy. Just gotta type it in. All right, no questions online. All right, anything else? Anything else? Can we get another round of applause for Dr. Capitano? Oh my gosh, amazing. Great talk. Thank you so much. And I especially appreciate your pointing out the patient perspective. I think it is so, so important. Our first guest is Barbara Torrey. She currently works as a K-12 science coordinator at Gilbert Public Schools. She was nominated for Administrator of the Year in 2022. Barbara previously served as the STEM coordinator and biomedical science instructor at Red Mountain High School in Mesa Public School District. Named Teacher of the Year in 2012, Barbara was also a recipient of the ASBA ASA Golden Bell Award in 2015. Barbara has more than 24 years of teaching experience, ranging from freshmen in high school to seniors in college. Barbara ignites sparks both in students and in fellow educators. She equips teachers with the tools and confidence through collaborative workshops, engaging professional development sessions, and personalized coaching. Barbara believes that true understanding comes from connecting curriculum to current events, students' lives, and integrating career opportunities. So without further ado, Barbara, you're welcome to take the podium.
Thank you for that incredibly kind welcome. And I'd like to give a huge shout out to Gilbert Classical Academy and Campo Verde High School for coming today. I know you guys are going to have some homework to make up, but I hope you enjoy your time today. Today, I'm going to share the stage with incredible individuals that aren't just team members. They're cord blood warriors, ignited by a passion that's truly awe-inspiring. Sharing this platform with them is an absolute privilege, and I'm incredibly grateful to be a part of this amazing team. Today, we're here to share something special. And I am Barbara, and I'm going to be taking you back in history to how this all started. Back when I was in the classroom, I was always looking for ways to give my students real-world experiences, not just only in the lab, but with professionals in the STEM fields, because it goes beyond science. It's about developing those critical soft skills, communication, and teamwork. So I made it my mission to attend every STEM, medical, event, science event I could find, and I dragged my students with me as well. Back in 2017, I was teaching Project Lead the Way's biomedical science, and I took a group of students to the STEM Expo at the Mesa Arts Center. This turned out to be a pivotal moment. There I was scanning the booths because you get all the freebies, right? And I met this incredible woman. You know those people who radiate pure enthusiasm? The kind that make you smile by just being around them? That was Charis in a nutshell. She was practically buzzing with excitement to talk to the next generation of students. Now I know everyone throws out the, oh, we'll keep in touch at events, and I'm sure she gets it all the time. But this encounter was different. I grabbed her card, determined to follow up. And follow up I did. I emailed her, and to my surprise, she not only responded, but offered to come out to my classroom. It's a scene that is still sketched in my memory. There we were, sitting in student desks, sharing a lunch that she brought, and the conversation was vibrating with excitement. We were just brainstorming ideas, but the passion in the air was electric. It was in that moment, sharing that infectious enthusiasm for getting students excited about science, that I knew I wasn't just talking to a colleague. I was meeting someone who would truly change the world. But Charis didn't stop there. True to her word, she returned to present to all my classes, and her passion was contagious. The students were hooked. She returned again, and not just by herself. She brought a whole posse of friends, from medical professionals to researchers, just as passionate as she was. Our classroom became a hub of STEM enthusiasm, and the students thrived on this exposure. It was during this incredible time that another pivotal moment occurred. Through Charis's network, we were introduced to the amazing Dr. Milano. Dr. Filippo Milano was able to connect to students on so many levels, from his passion with soccer, to his love of cooking, to his current research. He has this incredible gift to take really complex concepts and break them down into bite-sized pieces, making them crystal clear for students from freshmen to seniors. It wasn't just about the information, though. Dr. Milano created a safe space for questions. Students were not afraid to ask questions, and after class, they literally lined up to pick his brain. But you could see the joy and excitement on his face interacting with those curious minds. But our passion didn't stop at my classroom walls. We always talked about how to take this spark, this excitement for STEM, and share it with a wider audience. We wanted to reach beyond my 200 students a year. That's when Charis, the Ever Connector, introduced me to Melanie. Together, the three of us became a team, the passionate STEM dream team. And we spent countless hours brainstorming and planning and putting an action into plan. The dream team began to grow and attract more fantastic minds who also shared our vision. And that's how cord blood in the classroom became a reality. We are preparing the next generation for the future and introducing them to the world of cord blood stem cells and the valuable careers surrounding this cellular technology. The future is here. Arizona will lead the nation in bringing this important scientific education and technology into the next generation. And so now, with this project's background in your mind, I would like to introduce the marvelous Melanie. I totally forgot to use this. Oh my gosh, I'm so sorry. So sorry. Okay. Unlocking potential, equipping the next generation. All right, there was my agenda. So sorry, I got so excited about the moment. So the history. So there's a video that's going to play in the center. So you can see this was one of my classrooms at Red Mountain, and these are some of my former students. And that's Dr. Milano. And he would come almost every year. And he was like the pop star. He was super, like the kids were super excited. They would never miss class that day.
Barbara, thank you. I think you matched Charis in the enthusiasm department. Good stuff, good stuff. All right, Melanie Hall serves as Director of Student Education at Save the Cord Foundation, a 501c3 nonprofit charity. As content designer of a curriculum aimed at increasing awareness and interest in cord blood stem cells, Melanie brings a unique blend of analytical thinking and innovation to her work, consistently seeking creative solutions when promoting initiatives. With a dedicated focus on enhancing the human experience in healthcare, Melanie works at Mayo Clinic as a contributor on the patient experience team. Earning her BS in Healthcare Administration from Brigham Young University, Idaho, Melanie has over 12 years in nonprofit leadership, marketing, program development and management, as well as promotion. Melanie, show us your slides.
Thank you. So in 2022, January 2022, I went through some networking. I was connected to Sheris Ober. And as they say, the rest is history. She has so much enthusiasm and she engaged me in a project. At the time, I was looking for an internship in medicine and healthcare. And she had this pipe dream project that she needed to help create. She needed someone to help make a reality. And so the project was developing curriculum that would bring cord blood into the classroom. So after many brainstorming sessions, we came up with an outline and vision for the project. And our overview included a clearly defined purpose, objective, and scope. The curriculum would build awareness about cord blood as a cellular therapy, as well as introduce related careers. It would be foundational, so we could adapt it to future needs and to various target audiences. It can be used in Arizona and then spread throughout the nation and hopefully spread throughout the world to inform and cultivate an understanding about cord blood. The foundational curriculum was targeted to high school students in upper high school science classes with the intent that it could be basic enough to possibly be used in like biology or some of the just cultivating common or basic information about cord blood. The educational program would be comprehensive, providing basic facts, engaging activities, and encourage a deeper understanding of personal significance. Components would include breaking it down into the fast facts of cord blood, engaging the learner through interactive activities. It would address personal application. Why does cord blood matter? And why did cord blood matter to the learner? And finally, we would educate on where cord blood was headed into the future. But we also identified some important criteria. We recognized that the information needed to be credible, and it also needed to be current. As an architect, I wasn't a scientist or expert in the field. My background was marketing and public relations. And finally, so from the beginning, we determined that accuracy was going to be really important. And that was very important to me throughout the project. Additionally, we recognize that the content may be intimidating to a lot of educators. And so we focused on developing components that were easy to adopt and use no matter what prior knowledge the educator had. Here's a quick overview of what we have developed. This program lives on the Save the Cord Next Generation website. It includes an optional lesson plan, giving an outline or an order of how each component can be used to build understanding. But the program is also set up where it can, in a way that users can pick and choose from a library of primary components. The first component is the vocabulary section. The section introduces learners to key terms and definitions associated with cellular therapy and cord blood. Here is an example of what those slides look like. There's 35 of them, and they go through some of the key terms and definitions of cord blood. The next component is the core concepts section. In this segment, learners receive the fast facts or basic foundation of cord blood. To address some of that intimidation that we anticipated, we created a webinar. In fact, Dr. Megan Capitano is the presenter. And to make this easier for educators to adopt, the 23-slide presentation is also available for download when educators are more confident about teaching the material themselves. This is a sample of what those slides look like. Here, more explanation is given about stem cells, cord blood, the collection process, transplants, what cord blood is currently being used to treat, and what is being investigated to treat. Embedded in the presentation are short videos that reinforce the concepts being taught and help to engage the learner. Recently, we also added a bingo game that can be played during the webinar or while being instructed as another element intended to engage the learner and facilitate learning. The next component is the career section. We found that this was particularly critical to high school students who are at a point where they're trying to decide what to study or what they want their job to be, what career they want to pursue. Our next section is the escape room activity. This is an interactive way to reinforce what is taught in the vocabulary and core concept segments. We have created this as a virtual activity, introducing a scenario, followed by puzzles to solve as a student is taken through the storyline. I'm purposefully not going to go into this too much today because it's actually being debuted to the students that are here. And I don't want to give anything away. So this has been a quick overview of the program that we have developed. Now I want to share just a little bit about where we are in launching this program. So after working on this project for 2 years, our first classroom test was in Mrs. Clarissa Monreal's biomed class at Campo Verde High School on February 2nd, 2024. We're so glad you're here. We presented the vocabulary, core concept portion, and a portion of the career sections to her junior and senior classes. And at the end, we conducted a brief survey among the students to get their feedback and suggestions. Kylie just presented to the Future Doctors Club at Gilbert Classical Academy on Monday of this week. We're so glad you're here too. We will take all of the feedback that we receive from these classes and spend the next few months making enhancements based on their feedback. One activity we already added was the bingo game to make that webinar or presentation more interactive for them. Once this foundation program is ready for full launch, it will be available to anyone through Save the Cord Foundation, Next Generation website. Here, an educator or learner may create a login and receive access. After our full launch, and actually simultaneously, because right now we are working on an adaptation of this curriculum for the nursing community. We will build the curriculum out to educate and invite awareness. Everyone that we have shown this to so far has seen some benefit or use for it. And so we are really excited about that. Consenters, collectors, nurses, raising awareness among legislatures, even investors in related biotech projects. And there has been interest in reaching various education levels too. So we are really excited about this program and where it can go. And with that, I'd like to turn it over to Charis.
Melanie, thank you. Oh my gosh, I'm so impressed. I can appreciate the work that has gone into this program. Oh my gosh, nice job. Charis Ober, to know her is to love her. She is the founder and executive director of the Save the Cord Foundation, a 501c3 nonprofit charity. She's a global advocate for umbilical cord blood education, awareness, research, and legislation. Charis is a graduate of the University of Arizona and has more than 25 years of experience in pharmaceutical and biotech sales, marketing, and product development. After working for many years in the biotech and pharmaceutical industries, Charis and her friend Anne Sarabia, future founders of the Save the Cord Foundation, were invited to tour a cord bank in Tucson, Arizona. During their tour, these two career women and mothers met two extraordinary children who had received life-saving cord blood transplants. It was then that they decided that no more cord blood should go to waste. They decided to focus their efforts on establishing the foundation and advancing cord blood education across the globe. I'm proud to introduce to you my dear friend, Charis Ober.
Thank you so much. Hi, I'm Charis Ober. And I want to tell you that this is really a dream come true. It's been a dream that's been on my mind for many, many years. And I asked myself, with this incredible science and possibility for incredible careers, why aren't we talking to the next generation of young people? all of you out here deserve to know about this science, and you deserve to find out about the incredible careers that are going to be available for you now and in the future. So I'm here today to share that information with you, to motivate you, and to shine a light on your path. Because one day I may meet you and you're going to say, guess what? You and your group helped me attain this position. I'm so happy. You're saving lives. You're helping, individuals that before had no other opportunities at a second chance at life. And you could be changing the face of science and history right here in Arizona. So thank you all for coming today. And this is all about you in the back row. So before I get started, I want to turn up the volume a little bit and get you motivated. And I have a quick question to ask you. What are the 5 C's of Arizona? Does anyone know? And if you don't, that's okay, because I do. Cotton, cattle, climate, citrus, and copper. But guess what? There's a 6th C. Who knows what that C is? It's cells. We're going to be, and I'm not talking about phones. I'm talking about stem cells, stem cell technology, and all the biotech that's happening right now before your eyes and laying ahead of you in the future. And we're so fortunate to be in a state that had the vision, that had the roadmap to the future, that not only wanted to talk to the general public, to our healthcare providers, expectant parents, but what about the next generation of young people coming forward? It's all about you. And we're here to touch and change your lives and make it better. And so that's what it's all about today. And our first, oh, this is scary. I'm not very techno oriented. Here, would you do that? Here, advance for me to the next one. Okay, all right. So this is what it's all about. Okay, you learn about the science, but what does it really mean to you in the future? And it's all about your careers and your career path. And you can do anything you want with this kind of cellular education and technology and biotech information going forward. So this slide is really about you. It's built into 4 different components, but I'm just going to be talking about the careers today because there are so many, and I want to light your fire and light your mind into thinking, wow, I'm interested in that. I could do that. Because so many people don't have a mentor that can tell them that anything is possible. So let's look at my first slide. And that's the consent staff. And we are so blessed and lucky to have our consenters here today and our collection specialists. And I want to acknowledge all of you for making this possible, this program possible, because without these individuals, we wouldn't even be collecting cord blood. They're in getting important medical information from the patients, from the expectant moms that are coming in. They're talking to them. They're educating them about, no, we're not going to clone you or do anything strange with your cells. These cells are going to be used to save a life or change a life in the future. And then they're there doing a very precise scientific activity, and that's collecting the cord blood. And last night I was talking to some of the consenters, and it's an art and a science to get a good collection, to get a big bag of cells. The most amount of nucleated cells that you can in the biggest volume spells out the most successful transplants. So thank you to our consenters. And you can see all the different opportunities there that lie ahead with the consenters and collectors in the hospital. So I'm going to move on to my next slide. And that's the medical staff. And right now there are so many opportunities for every student in this room. You can be a nurse practitioner, a physician assistant, you can be a nurse, you can be a physician, and you can also, there are so many medical specialties that are part of this transplant and birthing process. You could consider being an OBGYN, an oncologist, a hematologist, a transplant specialist, pediatrician, and within the nursing community, there are so many nursing specialties that can apply to this. And let's not forget about the midwives too. They're also collecting cord blood for us too. Next slide, please. Okay. What about logistics and transportation? People wonder, how do the cells get from the hospital to the bank? Anybody ever think about that? Well, that also is an art and a science. We ship them at ambient temperature. We only have 44 hours to get those cells from point A to point B. They have to go to a reputable bank. And we're so blessed and lucky to work with MD Anderson. And we're here with Aaron Eaton and Jeffrey Wilson today, who control the cord blood bank there and also the lab. So thank you both. But the logistics people are the ones that are flying the planes. Think about during COVID when the whole world shut down. And maybe people had a bone marrow transplant that was going to happen, but maybe your bone marrow transplant person was in Germany and you were in the United States. Remember when the planes stopped flying? There were a few transplant companies that were continuing to fly back and forth and provide those patients with the valuable cells they needed. They'd already been ablated. And so that's why this transplant and transport is so critically important. And then how do they get from the bank to the hospital where the transplant's going to take place? And many people think this just miraculously happens, but it doesn't. It's because people are on the ground. They are working under a precise time schedule. And if they don't, these cells are not going to have the viability and integrity to be used in a transplant. So again, thank you to our logistics and medical courier specialists that work with us every day in the Arizona Public Cord Blood Program. So next, let's talk about, so I got that backwards, laboratory and banking. This is a very scientific, obviously, positions that are on the screen. And you can see we're talking about a clinical cell therapy associate, a specialist, and also lab supervisors. These individuals many times don't have interactions with the patients. They may hear about the patients. Actually, Jeffrey Wilson was talking about this last night. On certain technologies he's using, they would customize it and he'd say, I have to stop and think about the patient and what their particular needs were and what the circumstances were. But you may have never gotten the opportunity to meet that patient because you're working in the lab creating all of this to go forward. So their careers are within the specialty of processing, banking, HLA matching, but they are so very important and critical to the success of our transplants, because if we didn't have them, none of us would be here today, and none of the successes that we've seen with over 90 transplants and many thousands of units of racially diverse cord blood that has been collected by the Arizona Public Cord Blood Program. Okay, so next let's move on to research. This is what Dr. Capitano does. Without researchers, PhDs, physicians, and scientists, we would not have the transforming, life-saving technologies that are being discovered every day. Research is contributed to by both private banks and public banks or centers like MD Anderson, Duke, the Cleveland Cord Blood Bank, and at Indiana University, where Dr. Capitano has taken over Hal Broxmeyer's lab and continues to lead the way in important cord blood research. Cord blood units that don't meet the TNC and the volume here at our own Arizona Public Cord Blood Program are used by researchers at MD Anderson and across Arizona to continue important life-saving, life-changing advances in research. And I think of the work being done at MD Anderson right now with the CAR-T and NK work, which is going to revolutionize and change the face of transplant. So hats off to you. Thank you for all of our friends at MD Anderson. And last but not least, public policy and regulation. These can both be medical and non-medical careers. Maybe none of you had ever thought about it, but we the people have a voice. And in Arizona, we can make a choice to fund our cord blood program and make sure that it goes into perpetuity and becomes a legacy program for the state of Arizona. We have one of the most incredible programs here in Arizona with collection, processing, legislation. We're attracting many biotech and other companies here. And then we have individuals like you that are going to be, the next scientists, PhDs, people in public health that are going to be really fortifying our state and making it probably one of the best states in the union as far as collecting cord blood and moving forward with research. So back to my talk, it says, these individuals, it revolves around public policy and making these technologies both accessible and safe for the public. Individuals may have a degree in public health, public policy, or work in the legislative or lawmaking realms of politics. An example is the NIH, FDA, and Arizona's own Arizona Department of Health. So there you have it. And I've only touched a few of the opportunities that are available. And there are going to be so many more careers to explore in the future that we haven't even imagined or dreamt of. So my message to everyone in the room, and especially all of you in the back row, is hold on to your education dreams and don't let anybody tell you you can't do it. Consider all the amazing job opportunities that lie ahead of you in this great state. And remember, you can be and do anything you want with your life. This is all where it starts and where it's happening. The world of cellular technology and bioindustry is just getting started, even though it's been around for over 30 years. You're living in a state that has a long history of cord blood banking, collection, and transplant. And there is a potential to provide incredible high-paying careers right here in Arizona and jobs for the next generation of Arizona's students. Thank you.
All right, I would like to welcome back to the stage Dr. Megan Capitano.
So last year at Cord Blood Connect, little did I know that the person presenting the poster next to me would become my future stalker. Self-acclaimed future stalker. Didn't take much stalking. One asked, and I was like, she's like, can you help me with this? And I was like, yes. So it didn't take much stalking. I got lucky to be included in this group of brilliant, enthusiastic, and let me tell you, most pleasant people I've ever worked with. Because we were joking about this last night, actually. You know, how many times you go on Zoom and every face on that Zoom is like, go on Zoom with these ladies, every face is like, makes working with them such a pleasure and so easy, and it makes you enthusiastic to want to do it. But I'm going to talk to you a little bit today about what role they asked me to play. And the part of that is ensuring the accuracy of the information and how and giving examples of how to teach the course so that either they can use the webinar that I did or recorded, or they can hear what I had to say and utilize how I emphasize and how we emphasize in the slides certain concepts to educate in the classroom. So what were our key goals in creating our educational materials? And I'm going to go through each of these individually. The first one was understanding the scientific jargon by defining vocab words. Now, when I say scientific jargon, anybody here who's been to scientific meetings or written an NIH-style grant, we have to write what's often a lay abstract, which means we have to take our science and be able to explain it to the whole population. And sometimes we can get bogged down by our own scientific knowledge. And we get used to using jargon that we understand from using it every day in our talking to our staffs in our laboratories or in our clinic, and not realize what we're saying is not going to be understandable to the rest of the population, because we know these terms, we know these abbreviations. Oh gosh, are the abbreviations extensive? And so we forget sometimes that the words we're using is not going to be understandable necessarily to everybody. So we helped choose some of our vocab words on our vocab list to make sure that we're presenting and defining words that are important. And some examples of that is, if someone were thinking about donating cord blood, what would they need to know this word? If you want to know what a stem cell is, do we need to know this word? Could the public possibly have a different understanding of the term? And this is especially important when we talk about cord blood, because often, for instance, when we say stem cells, the first thought in a person's mind is not the stem cells that produce all the blood cells that we use for transplantation, but often the first word they think of is embryonic stem cells. And it has a totally different connotation than the adult stem cells do. So we picked defining what all these words are. So there's no misconception of what we're actually utilizing in the clinic. Also, the importance of this is that we can group these words into specific contexts, like, for instance, we know what malignant disease is versus non-malignant disease. What is the different types of diseases we can treat with transplantation? Teaching what these words means also helps reinstate the possibilities of what this cord blood could be used for, and can help you relate back to, for instance, like malignant disease. Well, I know somebody with one of these malignant diseases. Knowing somebody will help make a connection in that mind of the learner to remember what they're being taught. Next is clearly stating, why should I care about cord blood? Sherry's talked about cord blood as becoming a part of one's career, but also teaching cord blood in the classroom may help to one to decide whether to save or donate a cord blood as a future parent. Someone may need to know about cord blood treatment for somebody they know. Also, as a citizen, you may have to vote on policy that may affect cord blood collection or scientific funding. This is especially important. Anybody who's tried for NIH funding knows that we would always use more of it, right? The United States is one of the biggest funders of research, but every year with political divide, research money changes. And we always need an advocacy to our government that says, hey, keep the money flowing so we can keep saving lives. So this is actually a very viable career. And when we say career, it's not only in advocating for science or creating law, but it's also in teaching the science to our political departments. I have a friend with her PhD. She used her knowledge to actually translate scientific findings to the State Department, so people can understand what research in the United States is being done. So there's a lot of job opportunities you don't quite think about, but they actually play a vital role in keeping research going. Also, part of the curriculum we thought about was discussing what happens to the cord blood once one donates it, to demystify the process, right? Studies have shown that the more knowledge about the donation process leads to greater propensity to donate. And demonstrating, there's also been studies that showed that demonstrating that utilizing webinars and videos and interactive material about tissue donation is more highly effective and appreciated by the participants, and it better translates that knowledge into a long-term understanding of the procedure. So part of what we're hoping to do is to demystify that collection process and do it in a way that's interactive enough that the students remember in the future. We also want to discuss the history and process of the use of cord blood and how it made it to the clinic. History tells us how we came to know what we know, why research is critical, and why doing it is difficult. And knowing this history makes the idea easier to remember in detail. Plus, it's just fun. Come on. Knowing how something went from start to finish is just fun. Like, history is my favorite part of science in a way, because you have to know the history to be able to develop the future. So, also emphasizing to the classroom what we can really do with the material. 80 plus diseases that can be treated with umbilical cord blood stem cells. Okay. I guarantee you in that room, at least one of those students knows somebody with one of those diseases, and that makes it personal and helps them to remember, right? Also, helps motivate them in the future. If you could think of a disease that may in the future be treated, such as some of the autoimmune diseases that questions were asked about, oh, now, hey, you can go into research and help me figure out a way to do it. Also, to generate excitement, as I touched on, about how cord blood may be used in the future. So I'm going to keep saying this over and over and over again. Actually, I have another talk later, and I'm going to say it then too. over 40,000 lives so far have been saved with cord blood transplantation. Let's increase that with future research and spread cord blood usage to multiple other diseases, and such things as immunotherapy and regenerative medicine. And I can use your eyes' help on that. So let's do it. Let's figure out a way and get this classroom, get people excited about doing cord blood research so we can help save more lives. And with that, we can do our panel discussion.
Thank you so much. Okay, so Sheris has a couple more ladies that she's going to call up, right?
So, first of all, I'd like to thank all the women on this stage. Without their help and vision and tirelessly working, none of this would have happened. From Barbara Torrey opening the keys to the classroom and inviting us in, and her excitement and you know, to bring this into the classroom for the students has been phenomenal. Melanie is the architect and the creator of the program. She didn't speak cord blood when she first came to me, but now she's very fluent, trust me. And I also want to thank Dr. Megan Capitano, because without her, we wouldn't be here today either. She vetted the entire script and all of the pictures and everything we're using, because the last thing I would ever want to happen is to put out anything that was not factual or exactly perfect. And I also want to do a nod to John Garcia, because he always believed and was continually encouraging me in this process. And I kept telling him, John, we're going to get there. We're going to get there. And now we're there. And thank you, Victor Waddell, too, for all of your help with and support in this. So now I want to bring up two very important people. Clarissa Monreal, please come to the stage. You're being called. And Kylie Smith. Kylie, come on up. And these two women, Clarissa Monreal, opened her classroom. And she let us come in and teach and do our proof of concept. Thank you so much for believing. And Kylie is the messenger. She's been with Save the Cord Foundation for 3 years as a president. I first met her at one of these little programs that we had on, STEM programs. And she has become an integral, very important part of the whole cord blood education program, and will now be taking this into the classrooms all next year under the Arizona Public Cord Blood Program and the Arizona Department of Health. So thank you, John, for keeping her here. Thank you, Kylie. Thank you, Clarissa. And so I think we're going to open up questions now.
Yeah, sounds good. So super interactive, everyone. So any questions, fire away. They're ready for it. I would like to start with Clarissa, if that's okay. If you can kind of expand more on the experience of, you know, really the first time this was rolled out. How was it received by the kids? Is there any kind of aha moments from some of these students that really kind of blew you away? Can you tell us more about that?
Well, I'd like to thank Barb Torrey. She was the first one to reach out and let me know about this opportunity. And then I got the follow-up emails from the ladies, and we did a couple of Zoom calls. So like Barb Torrey said at the beginning of her presentation, she was part of the biomed program from Project Lead the Way. And that's what I teach here with my students at Campo Verde and Gilbert. And these are juniors and seniors. So it is a 4-year program. Most of them are pursuing a health career. And they do get introduced to a lot of different health careers throughout the 4 years. I chose juniors and seniors because they would have had the gist of a lot of the information and medical terms and things that we focus on throughout the 4 years. And they were really open to being able to receive the information and then give the feedback of how it would relate to, they had to kind of turn their thinking caps, because they are engaged in so much about medicine and health, and they have that prior knowledge, whereas to a regular science classroom might not as much. So they were really open to trying to figure out how to make sure that other students that are just in not that it's just a science class, but another science class, be able to understand. So they gave hopefully enough feedback for them to kind of improve a little bit on the PowerPoint presentations and still make it viable and exciting for kids to learn. And I would like to say that most of these kids are juniors, and they are going to get all of the HLA topics in the next month. And I was like, this is why you guys look like you don't know, because they haven't gotten to that part yet. I hope that answers the question.
Absolutely. No, thank you. And I guess for anybody, after that first experience, was there anything that you changed significantly because of that? Anybody, take it away. Melanie's going to have at it.
Actually, that's the next phase. So we were waiting for this conference to end so that we can apply all of the feedback that we've received from students. And over the next few months, that's what we will be doing, is going through that feedback, which was very valuable. We appreciate the students taking the time to write their notes, to be very bold, and to give some direction and some thoughts about what they think could improve. And that's the next stage, right?
And, we thought we had it all covered. I thought I had all our bases covered. And then after we did our presentation, a little hand went up and they said, well, where are the transplant recipients? And boom, a bell went off in my head. I completely forgotten about that. Where are the individuals whose lives were at stake and received a cord blood transplant? And what about the regenerative medicine patients? We're going to meet one this afternoon, Luke Fryer, who is one of Dr. Kurtzberg's very first CP in kids that you'll see, it's just amazing. So we are going to continue to build this out, and there are going to be many sections, such as its own history section. We're going to have our careers section. We're going to have our transplant section. And then we want to go to individuals like Jeffrey Wilson, who works in a lab, and he can do a 2 or 3 minute cameo on what does it take to be a lab manager? What do I do? And what's my job description? And how much money do I make? And, what do I do? So it's really important to flesh this out. And Rome wasn't built in a day, and this won't be either. But believe me, it will continue to grow, and it's going to make history for the state of Arizona. I don't know any other state that is going to be moving into the classrooms, and I hope we set a precedence for the other 49 and around the world too.
Dr. Capitano, going back to the jargon, I know you explained a little bit, but after kind of our guinea pig classroom, anything that you changed from your piece of this whole pie?
Haven't seen the results from the classroom communication, but I'm sure I will be. Because again, sometimes as a scientist, you get bogged down, the words, you use them all the time. You just assume you're surrounded by people that also know the words. You assume they don't know it too. So everybody knows them, but it's not the case. So you're constantly working to educate better, and nothing's ever going to be perfect until you get feedback back. So I'm hoping we'll get feedback. We added a couple questions to the that will be added to the questionnaires for the students, so we also know how to get that jargon to be more accessible to everyone.
Haley, what about you? Anything that was really surprising for this first round of experimentation?
Yeah, I think one of the things that we noticed the most was that we needed to make it a little bit more interactive to keep the students engaged. And like Dr. Capitano was talking about, sometimes these topics could be a little bit difficult to understand. So I think the interactive aspect is really great. And like Melanie said, we added on a bingo card, and we have the escape room too. So we're definitely adding a lot more for the students to get more involved.
Awesome, thank you. Do we have some questions online, Chandra?
Hi, we have a question from Rachel Manley. She wants to know, can you study cord blood at university? Where and how?
Oh, yes. I teach that class. So I teach intro to stem cell biology, and I have a whole class on cord blood in my stem cell biology class. I also teach for the NIH for the Centers of Excellence in Hematology intro to cord blood. And we teach, or not intro to cord blood, intro to stem cells, and I teach cord blood in that class too. And that's available to high schoolers, college students, med students. So that's available to multiple levels. But yeah, we do teach it in the classroom, in grad school and in undergrad school. So yeah, it's definitely available. Look out for the stem cell biology classes because they're fun. You'll learn all about some of the most high-tech science there is out there. So,
thank you. Any more from online? Oh, John wants a mic.
Barbara, so how does this fit into the overall journey of a student as far as requirements for graduation and stuff? How will this end up shaping their science requirements eventually?
Oh, that's a great question, John. We're still kind of like looking at that. But exposure is everything. You know, power, knowledge is power. So it'll be really interesting moving into the future, because they could be future careers or even future parents that utilize these great technologies. So that is something we're going to be taking a look at.
Any other questions? We got a question in the back. Thank you. If you don't mind introducing yourself too, please. That'd be great.
Cheryl Schmidt. I teach nursing at Arizona State University. I've been a Red Cross nurse since 1974. And one thing we've learned about Red Cross donations is it's not just A, B, O, negative, positive. There are 600 antibodies in human blood. And if I give my blood to somebody who has different antibodies, they can have a reaction. Is that considered in the cord blood or the stem cell research?
Yes. Matching is essential. As was discussed, there's multiple components that have to be considered when we're giving donations of cells to patients. And part of that is that there is an immune response, and you're giving, in the case of stem cell transplantation, you're giving that patient a whole new immune system. And if not matched correctly, that donation will view the body it's being put into as foreign and will attack it. That's called graft versus host disease. Also, you have the benefit, though, if there's some mismatch, especially in cancer, of something called graft versus leukemia, where that immune cells are different enough from those cancer cells that it recognizes it, and there's changes to that cell that make it recognize it as foreign. But you also have that case of ways we can change that to not be as important. And so some of the future of how I think cord blood could be used is to develop off-the-shelf cellular therapies where we can genetically alter the cells not to have the markers that make them be seen as foreign. All right. So we can make off-the-shelf immune cells that are specifically targeted to different types of cancer. And we can make off-the-shelf mesenchymal stem cells that can be used to augment immune response that loses those markers that make them look foreign. And then we can maybe utilize that in the clinic. And we're not totally there yet, but we're getting there, and it's getting closer.
So prior to getting a transplant, we actually check the patient's body for what we call donor-specific antibodies to that donor, whether it's cord blood or peripheral blood stem cells or bone marrow, because if there's high levels of these donor-specific antibodies that could interact with that stem cell product, the patient could reject that. So then we will look at that and base it.
Yeah. Thanks for clarifying. Another question. You introduce yourself, please. Hi, I'm Lauren Isley. I'm on the medical affairs team at Cord Blood Registry. Thanks so much for this panel discussion. I would love to hear a little bit about your thoughts on potentially translating this program or a version of this program to adult healthcare providers. I find in my line of work that many healthcare providers who serve as collectors, for example, OBGYNs and midwives, don't have a lot of education on the importance of perinatal tissues and making sure patients are educated and understand what their options are. So I would love to hear from any of you on how and if you think pieces of this program could potentially translate to, for example, a residency program or some sort of midwife certification program, and maybe how to integrate some of these components, because I feel like that's a really big component of what we're missing in terms of why there's potentially not as much uptake of cord blood donation or preservation. Thank you.
I think we absolutely need to do that. I think we have the baselines of a great educational program, and then it's going to be easily, I think, tweaked to go to the different levels of what it could be utilized for. Actually, we were talking to Cord Blood Association about having a poster at their meeting, and the person we met with was like, oh, I could think of, we can use it for this, consenters, we can use it for industry, we can use it even for government. And I could tell you, I can give you one example. Again, I totally agree with you. We need this in multiple levels, because I tried to put in a grant that was utilizing cord blood as a donor source for the stem cells for our experiments, and they thought it was fetal tissue and wouldn't allow us to put it in the grant. So it's needed. It's needed in all levels. So yeah, I mean, we want to get there.
Yes, and our next program that we're going to be starting up is a nursing program, and I have Joan Schneltz in the audience, who's one of our directors of student nursing, and she's going to be working on that with Chandra and another individual developing that. And again, Rome wasn't built in a day, but we've already got a platform to work off of. And again, I think this platform can be tweaked and changed to the specific demographics and individuals that we're going after. I think it would be fantastic for OBGYNs. Lauren, thank you for bringing that up. And by the way, I just went on an incredible tour of CVR the other night. Amazing what you do down there. And I just think the possibilities are limitless for this. It can be on YouTube. It can be in the classroom. It can be everywhere. So that's what I see with this. So great question. Thank you.
Thank you, ladies. Any other questions? Anything? Got a question from our student in the back.
Hi, my name's Alvaro. I'm from Gilbert Classical Academy. Coming from a smaller school, we don't have as many science class options. And as a framework, most of our courses are APs. How would you expect to or how would you plan to integrate a course or if module into a more, lack of better words, concrete framework as a curriculum?
Okay, that's a great question. We're going to have to really look at that, because maybe the first step would be to bring them into the classroom and just have like guest speaking. I know you guys just had a lunch, so you just had a snippet of what the potential actually is. So maybe sometimes I would actually have guest speakers come out, and I would be able to pull students from a class for an hour or during a lunchtime with a little extension, and then they were able to experience the full presentation of the guest speaker. So we could look at ways to navigate through your system, because every school is a little bit different, to figure out how to bring that to you guys. And we can definitely do that. We can talk later.
Can I add to that? Going through the PowerPoint presentation that we did see in January, it doesn't have to be where the educator has to start and finish within a time frame. I mean, they can chunk it and they can always go back to the topic. And if they're starting a unit on blood, they can talk about the blood and then kind of refer back to it as they go throughout the year. And depending on the experience that the students have, I mean, the educator can really make this as long or as short as needed, and still get the point across.
Exactly. It can be mixed and matched. And as I said, we're going to have new sections coming forward. So maybe instead of one day, it'll be 2 or 3 days that, the classroom can experience all these different sections. And we have a lot of friends here in Arizona. We have the Arizona Science Teachers Association and the AZ SciTech and AZ Bio. And I'm going to be knocking on doors once this is completely put together and going right to the teachers and going right to the chief science officers for AZ SciTech and asking them, invite us into the classroom. This program's available in September. It'll be out there, and your teacher doesn't even really have to know how to teach it. They can just turn it on, watch, learn, and go forward with it. So that's our plans. Very, very coming up here very shortly.
Is there another question somewhere here in the back? I feel like I saw another hand up. Chandra, anything online? Any other questions online? All right. Is this just for high school students? That was a question.
No.
You want to expand on that for us?
No, it's not just for high school. It's for everyone in this room. If you have questions about cord blood, you can go to Next Generation. You just log in and you have accessibility to all of the different sections. Then now that won't be available until September, because we want to make sure it's pitch perfect before it goes out. But this is for any and everybody, parents, children, teachers, any and everybody that has a thirst for knowledge, perhaps has a family member that has one of the 80 diseases that can be treated and cured with umbilical cord, or has a desire to go into the future with research, or become a healthcare professional. I think it's for anybody and everybody. So thank you.
Thank you, Cheris. And what about other languages? Is there plans to offer this in other languages?
Yes, actually, we'd like to turn this into a Spanish program too. We could do French, and I mean, the possibilities are limitless at this point as we grow. Great question.
I know you mentioned it's going to be available in September. Can you give us kind of a broader view as to what the timeline looks for this?
Well, we're continuing to do our proof of concept and tweak